Hi, I'm Dr. Nicole Nemeth. I'm a board-certified plastic surgeon. Today I'm going to speak about dermal fillers and what they are, what we use them for, some of the expectations, and who are they good for. So dermal fillers are a little bit of a misnomer, meaning we don't actually put them in the dermis in your skin. Rather, a hyaluronic acid filler is what we mean by dermal filler. And hyaluronic acid is a naturally occurring substance in your body and in your tissues. It can be found in the dermal layer of your skin, and its purpose is basically to act as a scaffold. This scaffold brings in water to the area, and the substance itself provides some volume and also absorbs water. We like to use fillers in many different aspects, particularly when we talk about non-surgical facial rejuvenation. And as the name suggests, they are there to restore volume. Areas that we can treat on the face in particular are areas where we lose volume as we age naturally. But some examples include the temples, the mid-face, to highlight the cheeks, sometimes in the lower eyes or the tear trough area, the folds that have deepened like the nasolabial folds or marionette lines, and along the jawline. Other popular areas include the lips. So sometimes we like a little bit of volume and moisture and hydration, and the appropriate dermal filler in that area can provide that. Almost anybody is a good candidate for filler if they feel like they want more volume or if they've lost some volume with aging. And there's very little risk with these. There's a very good safety profile with the dermal fillers on the market, as long as they are FDA approved. But there's very little risk for things like infection or having a reaction or allergic reaction to these substances. We like to use them for overall facial balancing. So the idea is that we want to give you a natural result. I always tell my patients not to be afraid of fillers. They like to quote stories where they see fillers that are very unnatural. And honestly, a well-placed filler session can take multiple vials, but the idea is that you want to restore that beauty and that balance that you had when you're younger, or enhance these natural features without looking unnatural. So I like to sort of reassure people that fillers can look very natural and are still a very important tool in our armamentarium when we're thinking about non-surgical facial rejuvenation. So the idea is that fillers are a very integral part of our non-surgical aesthetic practice. And I would invite people to come and take a look at what we can accomplish with fillers. And I think the results can be really beautiful and outstanding.